Blood pressure is important for cardiovascular health because of a few reasons. Now, we know that the higher blood pressure in the long term, there is a correlation, very strong correlation to a higher risk of stroke. And that is probably really a most important reason why we need to control blood pressure, is that if you higher the blood pressure, the higher the risk of stroke. Now, next to that, after that will be that the high blood pressure leads to also what we call hypertensive heart disease. And this can be manifested through increased risk of heart attacks, or in the long term, even if they don't get heart attacks, they may develop what we call heart failure just from hypertensive heart disease that's been with them for a long time. So I think for these reasons, high blood pressure is really related to cardiovascular health. And one other way that high blood pressure can also affect us is that it tends to increase what we call a shear stress in the artery, and then therefore lead to further narrowing in the vessels in the heart, or even in the arteries supplying the lower limbs, for example. So I think for most patients who have high blood pressure, it is actually quite important to control this pressure, if for nothing else, just to reduce the risk of stroke, which I think really is one of the most devastating things that can happen to anybody. So for patients who struggle to control their pressure, I think we often forget that it is just not medicines alone, but the entire lifestyle. Again, I think one good way to control the blood pressure is to lose weight, and that will be to change their diet and have more exercise. What's been also shown to help is to have a low salt diet, and that means that you don't have any further added salt to the food that we eat. That alone perhaps can reduce the pressure somewhat, at least in the population-based studies. And nowadays also the thinking is that a low refined sugar diet may also help with blood pressure control. For many of these patients, unfortunately, even with these, it is not enough, and we have to use many drugs. And most patients, actually, once you have high blood pressure, it is likely that you will need at least a combination of 2 drugs. We have 4 first-line drugs that we can choose from, and most patients will need 2 of them. Some patients will need all 4 classes of drugs, and even more, the second-line classes that we use. And some patients actually need quite a lot of drugs to control their blood pressure. In the recent years, there has been a therapy that's come out where we can actually perform what we call a renal denervation, where we kind of use a special catheter, a rubber tube, that we insert through the groin, and this will go into the arteries in the kidney to sort of burn off some of the nerves that supply the kidney. So this therapy has been shown to reduce the blood pressure, and it could become a therapy for some patients who are not being controlled with many medications and have no other options. But I don't think that this therapy will be suitable for everyone. It is really for a select group of patients. For most patients, the blood pressure can be controlled with a combination of drug therapy and lifestyle change. So currently for renal denervation, I think we would recommend this therapy to patients who are, for example, already on at least 3 or 4 medications and whose blood pressure is still uncontrolled. For example, if they are on 4 classes of medications and they come to us with a pressure of, for example, 160 over 100, I think we could consider this patient for this therapy, especially if he's quite young. For example, a 50-something-year-old or 60-something-year-old patient, because they have many more years to live. But if it's an 80-year-old, 85-year-old, then of course the situation changes, because your expected lifespan will no longer be so long. So then again, it has to be individualized to each and individual patient.